If you are watching this video, it means you are considering liposuction. Hi friends, I am Dr. Ankit Gupta, and in today's video, I'll explain you in detail about what is liposuction, who is a right candidate for liposuction, what happens during this surgery, what are the things that you need to take care of before and after the surgery, and what are the risks or possible complications of this surgery. So if in case you are considering liposuction, this video is for you. Hello friends, I am Dr. Ankit Gupta. I am a plastic surgeon and I practice in Delhi at Panache Hair Laser Plastic Surgery in Pitampura, New Delhi. So guys, many people think that liposuction is only to reduce fat. Now this is not true. Liposuction is not a weight loss surgery. Liposuction is a body contouring surgery. So what is the difference? See, if you are going for weight loss, if you are overweight, if you are say maybe 100 kilograms or more than that, or if your BMI is more than 35, then liposuction is not the surgery for you. In case you are looking for that, liposuction is the wrong surgery. You should go with drugs like GLPs or maybe bariatric surgery. Liposuction is to contour your body, that is if you have excess amount of fat in a particular area or to change the shape of your body. For instance, if I have a lot of fat in my underarm area, or if I have a lot of fat in my chin area, if I have a lot of fat in my flanks, saddlebags, then liposuction is a very good surgery for me. Now, what exactly is a 360-degree liposuction? 360-degree liposuction does not mean that we will be sucking out fat from all over your body. 360 means an all-round liposuction of your tummy, flanks as well as the lower back. Now, why are we talking about 360-degree liposuction? Because many patients, especially Indian patients, they have a lot of fat that gets accumulated into the flank area as well as the lower tummy area. Now, to get a very good shape, that is an hourglass shape or maybe a thin waist and a slightly bigger butt, you need to get your body contoured in a way so that the fat is removed from your lower back, the flanks as well as from the tummy area so as to make your waist thinner, and we can even take this fat and inject in the hip dip area or the butt area to give you a much better hourglass shape. So in 360-degree liposuction, what is covered is your whole tummy, your both sides, that is the flanks and the lower back area. And this is the most common type of liposuction that we do in our practice. Now what will liposuction actually do? In liposuction, we inject a fluid, let it stay there, which will mix with the fat and suck it out through liposuction. What it will do is it will remove the fat cells in that area. So if you have fat cells which are excess in your tummy, on your flanks, on your back, we can suck it out. Whatever fat is there outside your muscles, we can suck it out to give you a narrower waist, to give you a more contoured physique. So who is a right candidate? Anybody who is in a BMI from 18 to 35 can undergo liposuction. Ideally, you should be from 18 to 30. 30 to 35 is not the ideal, but yes, we can do liposuction if your target areas are very clear and if you are muscular. There is a stubborn fat area in a particular area in your body. If that is to be removed, you are a very good candidate for liposuction. If you are looking for weight loss, liposuction is not the right surgery for you. Secondly, your skin quality should be really good. Many a times I get patients who are 45, 50, they are a mother of 2 kids, they have a lot of loose skin due to their pregnancy, and those patients will not benefit from liposuction alone. We have to do a tummy tuck surgery for them if the skin is loose. But yes, if your skin quality is good, if you have never gained a lot of weight, maybe say you have never been 120 kgs, 100 kgs, or you have never had a child in your tummy, in those cases usually the skin does not stretch that much, and that is why only liposuction is sufficient and you do not need the skin removal and you do not need a tummy tuck in your case. So who are not a good candidate? Those who are severely obese, those who are looking for weight loss through liposuction, those who have a very loose skin or have a lot of hanging skin or who have lost a lot of weight, those patients would need a tummy tuck or something to tackle their skin as well. And other patients who do not have a realistic expectations are also not a good candidate. Also, if you suffer from major illness like diabetes, hypertension or other cardiac issues, or if you are on blood thinners, you have to first consult your physician and see if you are physically fit to undergo this surgery. Now coming to the surgery, how is it performed? The surgery is performed under general anesthesia mostly. If it is a very local area, we can do it under local anesthesia, but usually under general. We infiltrate you or we inject a fluid in the area where we want to do the liposuction. First the areas are marked, pictures are taken, then the fluid is injected, then we do a vaser liposuction. A vaser is a machine which would melt the fat and not damage any other tissues of your body. Then we use a power assisted liposuction to suck out all that fat, and then you are wrapped in tight dressings or in garments so that the skin contracts and gets adhered to the underlying muscles. What things can be added along with this? So if in case you have a lot of loose skin, we can trim the skin and that would make it a tummy tuck surgery. If somebody wants to use that fat and fill it in their faces, maybe breast or in their butt area or in their hip dip area, we can do that. That is a BBL surgery, in which we inject that fat into the butt area or maybe inject it into the hip dip area to give you a much more hourglass shape. Now, how long will this surgery take? This surgery can take anywhere from 30 minutes to up to 4 to 5 hours, depending on what all areas we are tackling and what all additional procedures we are doing in your case. For instance, for a simple double chin surgery, it will take around 30 minutes. But if you are doing a 360-degree lipo with fat grafting to your butt area, it would take somewhere around 4 hours. Again, is liposuction painful? So during the surgery, you are under the effect of anesthesia and you do not feel any pain or you do not have any sensations of that surgery. But yes, after the surgery is complete, you have that dull aching pain for about 2 to 5 days. So if you are considering liposuction, what are the things you need to know before the surgery? Number 1, you need to know if you are a good candidate or not. Number 2, get consult with a plastic surgeon, preferably who does liposuction very regularly in their practice. Number 3, if you smoke, if you drink, you have to quit smoking at least 3 weeks before the surgery, because tobacco in any form will hamper your vascularity. If you are on blood thinners, if you suffer from diabetes, hypertension or any other illness, you have to inform your physician so that they will see if you are fit for surgery or not. Other than that, if you have any other comorbidities or any other illness, you have to consult your doctor to see if you are a good candidate for liposuction or not. Before the surgery, you will have to stop all your multivitamins, green tea, fish oil, omega-3 fatty acid, etc. If you are on glutathione or any other supplements, we prefer to stop it at least 1 week prior to your surgery. Now, what happens after the surgery? After the surgery, you are in a pressure garment or maybe in binders just after the surgery, and then later on you are shifted into proper pressure garments. There will be bruising and swelling in the areas of liposuction. It will take about a month for good results and about 3 months for you to see the final results. But you will see the reduction in your diameter or the reduction in the area where liposuction has been done even on the surgery day. When can you walk? You can start walking after about 4 to 5 hours of your surgery, and we advise you to do that, and you have to consult your doctor, and if possible we would advise you to start walking for at least 10 to 15 minutes on day 1 of your surgery, so that there is no clotting of blood in your legs and you prevent deep venous thrombosis. When can you return to work? So it all depends on how much of liposuction has been done in your case. If it's a small area, a hidden area, then even on the second, third day you can go back to work. But if it's a large area like a 360-degree liposuction, you should take at least 7 to 10 days off. When can you join back gym? So I would advise you to wear your pressure garments for at least 1 to 2 months after the surgery. After 1 month, you can start your cardio, and after 2 months, you can go back to your complete physical routine. How long will your results last? So your results will last till the time you maintain your weight. If you gain weight, fat will not get accumulated in that area from where liposuction has been done, but will be redistributed to other areas of the body where liposuction has not been done, and especially in the area where fat grafting has been done. If you lose weight, the results of your liposuction will improve even further. If you are considering 360-degree liposuction, it's a very good surgery provided you are in a BMI of less than 30. If you are considering body contouring, if you want to contour your waist, I would advise you to go with a 360-degree liposuction instead of going for a plain tummy liposuction, because in that we are able to take out fat from your tummy, your sides, as well as from your lower back, and we can even use that fat to give you a much better bust or maybe a much better butt. In case you have further questions, you can always get in touch with my team and I'll be happy to help you. Thank you and have a nice day.